Welcome to Horizon Health Network. My name is Dr. Will Allenak and I'm an orthopedic surgeon. We are pleased to offer you this video to help you prepare for your total joint replacement. Having surgery can be one of the most vulnerable points in a person's life. The purpose of this video is to help you learn what to expect while you're in hospital and to help take care of yourself after surgery so you have the best recovery possible.
Research shows patients receive the best care when they are active participants. By choosing to have an elective joint replacement, you agree you will do everything you can to optimize your recovery. This means reviewing the education material, practicing the exercises we will review in this online class, preparing your home before you come to hospital, and arranging a ride home from the hospital. You will also be responsible for arranging for equipment before your surgery, and members of our healthcare team can help with that. We recommend you select a friend or family member to be your partner in care, someone who will be prepared to help you when you are most vulnerable. This might include assisting you with personal hygiene activities after your surgery when you're home. As this is an elective surgery, we need you to be in optimal health before your operation. In addition to making sure you have family and friends around after surgery, it is very important to make sure there are no medical or dental issues, as they could lead to a last-minute cancellation the day of your surgery or having a complication. If you are waiting for dental work or have any problems with your teeth, it should be taken care of before your joint replacement. Any underlying or new health conditions that have developed since you visited your orthopedic surgeon should be reported. These include worsening of pre-existing breathing problems, bronchitis, recent heart attack, uncontrolled blood pressure, a urinary tract infection, difficulty urinating, or any unhealed sores or abnormal skin changes. It is very important to let our surgical team know if there have been any changes to your health history, as new information discovered on the day of your surgery could lead to same-day cancellation, or you could experience a serious complication such as infection. We want to reassure you that if you do require rebooking your surgery, you will be rebooked as soon as possible. That could be a few weeks or months. It does not mean you go back to the wait list. If you have specific wishes about how you want the team to handle your care in the unlikely event of a medical emergency, sometimes called a code blue, please speak to a member of our team. If you smoke or vape, we recommend you reduce or quit smoking prior to your surgery, as nicotine delays healing and increases your risk of joint infection. We can provide you with resources in the hospital, but if you have not yet received a date for your surgery, you can contact the NB Anti-Tobacco Coalition for resources on quitting. Washing your hands and asking people around you to clean their hands will also help to reduce your risk of infection after surgery. At Horizon, we invite patients to politely ask healthcare workers to clean their hands before they touch you. Please remind your family and other visitors to clean their hands and to avoid visiting if they feel unwell or have cold or flu symptoms. Before your surgery, you will have an appointment in the pre-operative clinic, or a nurse will telephone you to get information needed for surgery. At this appointment, members of the healthcare team will review your health history, and you may have additional tests such as blood work, an X-ray, or an ECG. If you have a complex medical history, you'll be seen by an anesthesiologist in the pre-op clinic. Since your anesthesiologist is responsible for your overall care during the operation, they want to ensure that you are optimized before this elective procedure. When you go to the pre-op assessment clinic, please bring all of your home medications in their original bottles. Be sure to bring all medications that you take on a regular basis. Please include all tablets, capsules, creams, puffers, patches, eye drops, and injections that you take regularly. We also ask you to bring any over-the-counter medications, such as vitamins, minerals, and supplements. We'll make a list of your medications. This list will form part of your post-operative orders that your surgeon will order after your surgery. When packing for the hospital, we recommend that you pack your belongings in a bag that can be wiped down, such as a plastic suitcase or plastic bag. Fabric suitcases are not recommended. You should bring 2 to 3 pairs of loose-fitting clothing and personal care items that are scent-free. We recommend you pack supportive footwear that includes an enclosed heel and can accommodate swelling. If you wear a sleep machine called a CPAP, you must bring that on the day of your surgery. If you wear dentures or glasses, we recommend you bring them in their case. Please inquire with your local hospital if you are required to bring mobility equipment with you the day of your surgery. You should not bring a large amount of money, jewelry, or expensive clothing with you to the hospital. We suggest that no more than $10 be kept at your bedside. For your convenience, ATM machines are available at the hospital. You are welcome to bring electronic devices such as mobile phones to communicate with your friends and family. However, the hospital assumes no responsibility for loss or damage to your personal property. On the day of surgery, please take your medications as directed from your surgeon or the nurse in the pre-op clinic. Depending on the facility where you are having surgery, on the day of your surgery you will register at admitting or in the day surgery department. These instructions will be given to you at your pre-admission clinic visit or telephone call. Please bring all of your home medications with you again. The nurse in day surgery will review your home medications once more and complete a health assessment. You will also have an opportunity to speak with your surgeon and the anesthesiologist who will be giving you medication during the surgery. A nurse from the operating room will introduce themselves and ask you questions for a pre-op checklist. The nurse will accompany you to the operating room. We will start an IV and may give you additional medications prior to your surgery. There are several options to prevent pain and put you in a sleep-like state for your surgery. Depending on your medical history, previous surgeries, and allergies, we will discuss the anesthetic plan that is right for you. You may be offered a spinal anesthetic, which means a small needle will be inserted into your back and anesthetic injected. You'll be frozen from your belly button down for 2 to 6 hours. You can choose to be awake and aware during the surgery, or you can request some sedation. If general anesthetic is offered, this means you will be going to sleep for the surgery. Patients will receive a warm blanket to make them more comfortable. The healthcare team will do a final safety check before you are put to sleep. The length of surgery varies in time from 60 minutes to 2.5 hours. The length of time depends on several factors, including the severity of your arthritis and whether or not your joint has been replaced before. During your operation, your family is welcome to stay in the waiting room, and a member of the operating team can give them an update when your surgery is complete. Family may also receive updates from the front desk at the operating room if needed. There may be exceptions during pandemic situations where family are not allowed in the hospital. After your surgery, you will be moved from the operating room to the recovery room as you wake up from surgery. The time you spend in the recovery unit may vary depending on how long it takes you to wake up, and bed availability on the inpatient unit. After you leave the recovery unit, you will be moved to the inpatient orthopedic unit, where registered nurses and licensed practical nurses will be caring for you. Your family are welcome to visit you after the nurse has completed their initial assessment. The night of your surgery, we'll be encouraging you to stand up with help. Every day following your surgery, you will be expected to walk with the assistance of your care team. Safety is very important to us, so please remember that after surgery, you will need assistance walking until your care team tells you that you are safe to walk on your own. Do not try to get out of bed by yourself as you are at risk for falls. There will be a call bell at your bedside, and we always want you to push the call bell instead of getting out of the bed on your own. The nursing staff on the inpatient unit will be happy to provide updates to your family, but for confidentiality reasons, we can only provide the information to your designated next of kin. Horizon Health Network recognizes that family and friends are an important part of the recovery process. There may be exceptions during pandemic situations where family are not allowed in the hospital, but in normal circumstances your partner in care is welcome. We do ask that family and friends coordinate their visit with the patient care team, and the number of visitors may be limited due to space and consideration of other patients. Adequate pain control will be a priority after your surgery because it directly affects your recovery. Patients experiencing severe pain cannot take deep breaths or complete their post-operative exercises. The nurses can increase and decrease the amount of pain medications you are taking based on your pain level, so it is important for you to communicate how you are feeling. Ask for pain medication before you become too uncomfortable. Do not let your pain get to the point where you need pain medicine immediately. It is harder to ease pain once it is unbearable. Tell us if your pain is not getting better with the pain medication we give you. And tell us if you are experiencing drowsiness, dizziness, nausea, or itchiness. Nausea can negatively impact your recovery, and the nurses can treat it if you tell them. Some patients are afraid to take pain medications after surgery because they're worried about becoming addicted to pain medication. We use the lowest possible dose for the shortest possible time. As you heal, your surgical pain will decrease, and your need for pain medication will decrease too. During your hospital stay, the nurses will be monitoring your incision and will give you instructions on how to look after your incision. Once you are discharged home, you do not need a nurse to look after your incision, but remember to keep your incision clean and always wash your hands if you'll be touching the area around the incision. Factors that determine when you are ready for discharge include when your vital signs are stable and your pain is well managed, when you are able to get in and out of bed independently or with minimal assistance, when you can walk a realistic distance, and climb stairs safely if you have stairs at home. When you are admitted, we will discuss your expected date of discharge with you. You will be responsible for arranging a ride home from the hospital, as you will not be allowed to drive immediately following surgery. Finally, you may need extra help at home with activities such as meal prep, laundry, yard maintenance, or arranging drives for your medical appointments. We advise you to make these arrangements prior to your surgery. The role of the physiotherapist is to help you improve your mobility after your surgery. For educational purposes, the bandage located on the knee and hip illustrates the operative leg. Leading up to your surgery, it is important to exercise daily. This will help you to recover more easily from your surgery. It is recommended you choose an exercise that you enjoy, like walking, a stationary bike, or swimming. You should begin slowly with 5 to 10 minutes and gradually progress so that you are able to exercise 20 to 30 minutes 3 times or more every week. We will review the exercises that you will be doing after your surgery. We encourage you to start doing them now, twice a day, to build your strength. Learning and practicing these exercises will help you prepare for surgery and recover after surgery. The focus for the exercises is your operated leg, but the exercises can be done with both legs, one at a time, working your way up to 10 repetitions. It is normal that you may experience some pain and soreness when you start these exercises. If you are experiencing a lot of pain, you may need to start with fewer repetitions and consider taking pain medication as prescribed prior to your exercises. We also recommend not doing these exercises within the 2 hours before you plan to go to bed so that it does not affect your sleep. After surgery, it's normal for pain to interfere with your sleep. You can nap during the day to compensate for the sleep you are not getting at night. The first exercise is ankle pumping. Pull your toes up towards you, bending only at the ankle. Then, push your toes away from you. Pump so that you can feel your calf muscle tightening and relaxing. This helps to circulate the blood in your legs while you are less active. The second exercise is quad sets. This exercise strengthens the muscles on the front of your thigh. With your operated leg out straight, pull your toes up toward your knee. Tighten the muscle on the front of your thigh. Press the back of your knee down into the bed. Hold for 5 seconds to allow for a good muscle contraction. Relax and repeat. For this exercise, gently bend your operated leg by sliding your foot up along the bed. Bend until you feel a stretch over the top of your knee. Hold for 5 seconds, then lower your leg. Relax and repeat. The next exercise is hamstring sets. This exercise strengthens the muscles on the back of your thigh. Place a roll under your operated knee. With your operated knee slightly bent, dig your heel into the bed. You should feel the muscles in the back of your thigh tighten. Hold for 5 seconds to allow for a good muscle contraction. Relax, repeat. Be mindful that your buttocks should not lift and no knee movement should occur during this exercise. Next is an exercise called quads over the roll. Place a rolled towel or pillow under the knee of your operated leg. Ideally, if you have a juice can available, roll the juice can in the towel so the roll is more supportive for this exercise. Pull your toes up toward you and lift your heel off the bed to straighten your knee. Keep the back of your leg resting on the rolled towel. Hold for 5 seconds, then slowly lower your heel. Relax and repeat. The fifth exercise is glute sets. While lying on your back, squeeze your buttocks muscles together and hold for 5 seconds. Relax and then repeat 10 times. The next exercise is hip abduction. This exercise strengthens the muscles on the outside of your thigh and are used when getting in and out of bed and to walk. Slide your operated leg out to the side 6 inches or 15 centimeters. Do not lift your leg up. Keep your toes pointed upward. Return your leg to the starting position. Relax and repeat. After hip replacement surgery, follow-up by a physiotherapist will depend on your surgeon's instructions. Surgeons use different methods to replace the hip joint, so your surgeon will give you specific instructions about the movements you may need to avoid for the first 6 weeks to 3 months after surgery. These movements may include avoiding deep bends at the hips, for example, reaching to pull up your pants, reaching past your knees when sitting, or bringing your knee up to tie your shoes. Your surgeon may also instruct you not to cross your legs or ankles. If this is the case, you may wish to sit and sleep with a pillow between your knees as a reminder and for comfort. Your surgeon may tell you to avoid twisting your body at the hip or waist. For example, when reaching to put a dish into a drying rack after washing, be cautious to not twist your torso, but rather take a few side steps. Finally, you may be told not to turn your toes or knees inward or outward following surgery. After your surgery, you will need equipment to move around at least for the first few weeks. Please inquire with your local hospital if you are required to bring mobility equipment with you the day of your surgery. However, you will need to arrange for the equipment at your home. We will show you the proper way to move following your joint replacement. When using a walker, you should always have proper fitting footwear on and not be in sock feet. The walker height needs to be adjusted to fit your body. Standing with both arms at your side, the top of the hand grip should line up with a crease on the inside of your wrist. Move the walker about 1 step ahead of you. Keep your back upright and do not hunch over the walker. Move your operated leg ahead 1 step length, then push straight down on the grips of the walker and step forward with the non-operated leg. This is necessary to keep your balance. You should continue to use your walker until your physiotherapist progresses your mobility. A cane or crutches will be required for stability when traveling up and down stairs. If you have a sturdy railing running the whole length of your stairwell, a cane is usually enough. Crutches may be needed if you don't have railings, or if your surgeon tells you not to put full weight on your surgical leg after your surgery. A trick to remember how to correctly go up and down stairs is to think of the good or non-surgical leg going up first and the surgical leg staying on the bottom stair. So, when going up the stairs, lead with the good non-surgical leg. Grasp the railing and move your good leg up 1 step, followed by your crutch and then the surgical leg. Continue this way 1 step at a time. When going downstairs, grasp the railing, place the crutch 1 stair below, and step down with surgical leg, follow with the good or non-surgical leg. Repeat 1 step at a time. You may need to pay special attention to the way you get in and out of bed after your surgery. To get into bed, back up to it, extend the surgical leg. Using your good leg and arms, slide back on the bed. Slowly turn your body, bringing your strong leg into the bed first, followed by your surgical leg. To get off the bed, slide your body to the edge of the bed. Slowly lower your legs off the bed and turn your body until you are sitting up. Along with changes to your mobility, you may need to prepare your living environment to accommodate anticipated needs after surgery. The role of the occupational therapist is to help you and your family prepare for life after surgery so that you can become as independent as possible. We will give you tips on some of the equipment and assistive devices you might need to help reduce the risk of falling and maintain comfort after surgery. The environment you plan on living in after you are discharged from a hospital may require some temporary changes so that you are able to move easily and comfortably. We recommend you make any adjustments to your home before going in for surgery, as it may be difficult to do afterward. Some examples include temporarily setting up your living space on one level after discharge, preferably on ground level if possible. This may require moving furniture, like bringing a bed to the level you intend to stay on, or putting in a commode temporarily if there is no access to a bathroom on that level. Another recommendation is to install handrails or purchase equipment to assist you on any stairs in your home. We recommend removing clutter on the floors, including loose rugs, carpeting, or electrical cords that could cause you to fall. Lastly, consider rearranging furniture to provide more space to accommodate your walking aids. To help with comfort, independence, and function, we recommend placing items you use frequently on surfaces between your shoulder and hip height. For example, leave plates and glasses on the kitchen counter or on your dinner table to avoid reaching in high and low cupboards. In the bathroom, set up frequently used items on the vanity and ensure that shampoo and other needed items are within reach while bathing. Eating healthy is important after surgery to help the healing process. You may be too fatigued to cook nutritious meals after surgery, so we encourage you to prepare meals in advance and freezing them, arrange for someone to prepare your meals, or you may want to consider calling services like Meals on Wheels if it is available in your area. If you are still working, you will need to make arrangements for taking time off work during the recovery period, which varies depending on the individual and type of work done. Speak to your surgeon for necessary support and documentation. If you are a caregiver for a family member or friend, alternate care should be arranged temporarily for that person. Also, pet care after surgery may be difficult, and you may require assistance from family, friends, or boarding facilities. We recommend completing errands and grocery shopping prior to your surgery. When you come home from the hospital, you will need help with laundry, groceries, and house cleaning. Depending on the time of year, you may have to make arrangements for home maintenance, such as snow removal or lawn mowing. You may need to consider modifications to your daily activities and add equipment to your home before you come home from the hospital. We encourage you to practice these activities as demonstrated in this video before you have your surgery. It is important to take pressure off your new joint while sitting. The best chair to use after surgery is one that has a sturdy back and armrests. Make sure the chair is 2 inches above knee level. If a surface is below your kneecap, use a high-density foam cushion or bed blocks to raise the height. Sitting on higher, firm surfaces makes it easier to get on and off chairs or beds. To sit, back up to the chair until you feel it against your legs. Extend your surgical leg, reach back for the armrests, and slowly lower yourself onto the chair. Note the hips are higher than the knees. To properly get out of the chair, slide your hips to the seat edge and extend your surgical leg. Push up from the chair using your hands on the armrests and your good leg. Some considerations when choosing a seating surface. Avoid seat surfaces that rock, swivel, glide, or that have wheels. A chair with armrests will help you to push your body straight up, taking stress off your joint replacement. Optimal seat height should be about 2 inches above the back crease of your knee. Maximum seat height should be no higher than the bottom of your buttocks. Surfaces that are sometimes too high include vehicles and beds. If it is a couch or love seat, you may want to put a board under the cushion to make it firmer and a more stable base to transfer from. If you need to make a modification to your existing furniture, chair blocks or a platform can be built or purchased to raise the height of your chair. A high-density, firm foam cushion is another great option, as it is portable and can be used over different types of sitting surfaces, such as in a car or in your home. Firm foam cushions can be purchased at a medical supply store, local upholstery, or fabric store. If your bed is too low to comfortably transfer from, bed blocks or an extra mattress can be added to increase the overall height. In cases where a bed is too high, you can consider removing casters from the bed frame or removing the box spring to lower the bed to the appropriate height. Similar to your furniture, your toilet seat should be 2 inches above the top of your knee. If increased toilet height is needed for comfort, equipment such as a raised toilet or a commode can be used. Raised toilet seats come in varying heights. If a comfort height or elevated toilet is in place, a shorter raised toilet seat may be required or none at all. If the toilet seat height is good, consider a toilet safety frame for arm support. Most toilet safety frames attach to where the toilet bolts are at the back of the toilet seat. Installing wall-mounted grab bars is another option if the walls are close enough to the toilet. Trial all toilet equipment to ensure a secure fit. For example, toilet bowl shapes can vary and alter the fit and stability of the raised toilet seat. A commode over the toilet can be an alternative if a raised toilet seat does not fit. When sitting on a toilet, back up to the raised toilet seat as you would to a chair or bed. When you feel the toilet behind your legs, extend your surgical leg, bend your good leg slightly, and using both arms lower yourself onto the seat. To get up, slide forward on the seat, extend your surgical leg, then use your good leg and arm strength to push up. Make sure you press up on both armrests so that the device remains steady. Never use a towel rack or toilet paper holder to pull yourself up from the toilet. These could easily come away from the wall and cause you to fall. If you need extra support in the bathroom, consider installing grab bars. If you are up frequently at night or have a long distance to travel to get to your bathroom, you may want to consider using a stationary commode next to the bed. Urinals are another option. Male and female urinals are available from pharmacies or medical supply companies. Something to keep in mind is that you may be at an increased risk for falls at night because of decreased alertness and reaction time. please consider nighttime lighting and ensure you have a clear pathway to the bathroom at all times. Following your joint replacement, it is not recommended to submerge your incision in water until it has fully healed. Recommended forms of bathing following surgery include sponge bathing at a sink or using a basin at your bedside. This option should be considered if you are not feeling well enough to use a shower or bathtub. Sitting may help make it easier to bathe and allow for rest periods. Hair washing options include washing at a kitchen sink or laundry tub. Dry shampoo or no-rinse hair caps are also an option available at pharmacies. If you are using a walk-in shower stall, a shower chair may be useful to reduce putting full weight on your new joint and may reduce fatigue. If using a bathtub shower, a transfer bench is useful to help you get in and out of the tub. If you will be using a tub transfer bench to get in and out of the bathtub, 2 legs of the bench are in the tub and 2 legs are outside. Adjust it so that it is 2 inches above your knee height. If you have sliding doors, they will need to be removed and you may need to set up a temporary shower rod and curtain to accommodate the transfer in and out of the bathtub. To avoid water accumulating on the floor, shower curtains can be tucked under your thigh or into slits in the tub transfer bench to help direct some of the water back into the tub. Back up to the bench, extend your surgical leg, and hold on to the back of the bench chair. Slide back on the chair and swing your legs into the tub. To avoid leaning forward, attach a handheld shower hose to the bench and turn the water on before getting into the tub. To get out of the tub, bring your legs to the side and swing them over the bathtub. Slide to the end of the bench, hold on to the back of the chair, extend your surgical leg, and then push with your arms and good leg to stand up. Use a non-slip bath mat both inside and outside the tub. If you wish to practice another style of tub transfer without the use of a tub transfer bench, please consult your physiotherapist or occupational therapist for best options and equipment. Bathing aids may assist following joint surgery to enable independence. A long-handled sponge can be used to assist with washing your lower legs and feet. A non-slip bathtub or shower mat is recommended both inside and outside of the tub and shower to increase safety by reducing the risk of falling. A handheld shower head enables you to clean all areas of your body while sitting. A toe washer can help you reach to wash between your toes. Use a towel and long-handled reacher to assist drying between your toes. If possible, you may wish to ask a family member for assistance. A dressing stick or long-handled reacher is used to assist with putting on pants and underwear while limiting bending. To dress and undress, sit in a chair or on a bed. The surface should be 2 inches above your knee. To put on pants, take the long-handled reacher and pull the pant leg over the operated leg first, then the good leg. Move to the edge of the chair, extend the surgical leg, stand up and pull up the pants. When undressing, use the long-handled reacher to undress the good leg first, then the surgical leg. Other tasks the long-handled reacher is useful for may include picking items up from the floor, pulling blankets up from the end of the bed at night, and getting clothes out of the washer or dryer. It's a good idea to attach your reacher to your walker so that it is handy in various places throughout the day. Footwear after surgery should be enclosed, with a heel contour and a closed toe. The foot should not slide inside the shoe while walking. The shoe should allow for changes in foot size due to swelling, and it should have a firm but flexible supportive sole. For example, a sneaker with elastic shoe laces. Using elastic shoelaces converts lace-up shoes into slip-on shoes to increase comfort. A long-handled shoehorn can make slipping your footwear on easier while in a sitting position and enables you to limit bending. Using an aid to put on socks may be helpful for the first 3 months after surgery. Slide the sock onto the sock aid. The sock heel should be along the curved bottom with 1 inch of the sock in the gullies. Hold onto the string and place the aid on the floor. Slowly work your foot into the sock until your toes touch the end of the sock. Now, pull on the strings. The aid slips out and the sock moves onto the foot. To remove the socks, just slip a long shoehorn into the sock behind the heel. Cornstarch or lotion can be applied to the inside of the sock aid to help your foot slide in more easily. Be careful of powder falling on the floor, as this may create a slip hazard on hard floor surfaces. It is easier to put your pants on before your socks, as the socks may cause friction when trying to thread your leg into your pants. You are not permitted to drive until you receive medical clearance from your surgeon. Speak to your surgeon to know if there are any restrictions on traveling in a vehicle for the first 6 to 8 weeks after your hip surgery. When you know what vehicle you'll be traveling in after surgery, you may want to consider making adjustments to the passenger seat. If possible, move the seat you will be sitting in to see if you can maximize the angle, or you can consider using a high-density foam cushion to raise the height. You will want to place your high-density foam cushion on the seat so that the seat is 2 inches above your knee height. You may wish to use a large garbage bag over the cushion or on the seat itself to help you slide more easily. Other helpful tools are the handy bar and swivel seat. The handy bar provides a handle support to help you get in and out of a car. It attaches to the door latch. The swivel cushion has a non-slip base that keeps the cushion in place while the top swivels to help you turn your body into the car. When getting into a vehicle, make sure the passenger seat is pushed back and the seat angle is reclined. Back up to the car, extend your surgical leg, using your arms for support, lower yourself to the seat. Slide back as far as you can across the seat, and then bring both your legs into the car. To get out of the car, ease your legs out and keep leaning back. Extend your surgical leg and slide to the edge of the seat. Stand up using your good leg and arms for support. Getting in and out of a vehicle can be one of the most daunting tasks after your surgery. We recommend practicing this exercise at home before having your surgery. It is your responsibility to get equipment for your home prior to your surgery, and we recommend practicing with the equipment before your surgery too. Provincial Medicare does not cover home healthcare equipment. You are highly encouraged to investigate what you are eligible for through your private insurance plan. Some policies may cover a portion of the cost. If you are covered, you may require an equipment prescription to be filled out by your doctor. Most equipment is adjustable and can be borrowed from friends and family. Your walking aids will need to be in good condition and the height should be adjusted for you. Some equipment may only be needed for a couple of weeks and other items up to 2 months. Each item may vary in price to purchase or rent and is available at various medical supply stores and some pharmacies. Loaning equipment from Red Cross is free of charge, but equipment is limited and there may be a wait list for various items. You will require an equipment referral to be filled out by an occupational therapist, physiotherapist, or doctor to access equipment through the Red Cross loan program. Pharmacists work behind the scenes to ensure you are on the right medications. A new medication you will be taking after your surgery is an anticoagulant or blood thinner to reduce your risk of developing a blood clot. There's a risk of blood clot formation after hip or knee replacement due to the expected tissue damage after surgery and the fact that you will be less active. Some patients also have a history of blood clots or clotting disorders that may increase the risk of the post-operative blood clot. After you leave the hospital, it is important to know the signs and symptoms of a blood clot. Symptoms of a blood clot include chest pain, lightheadedness, out of breath, leg tenderness, and leg swelling. It is important to note that the leg tenderness feels different than the tenderness from your surgery. If you experience these symptoms post-operatively, don't delay seeking medical attention. Go to your nearest hospital or health center and be sure to tell them that you've recently had a knee or hip replacement. To reduce the risk of a blood clot occurring, the hospital will provide you with a blood thinner, and this medication should be continued after you leave the hospital. The choice of which anticoagulant that you will take depends on your other medical conditions, allergies, kidney function, and any drug interactions that might occur. It's important to note that these medications only do their job if you take them as prescribed. Upon discharge, you'll be given a prescription for the balance of remaining days of your therapy. It is important that you take this prescription to your drugstore and fill it as soon as possible. It is extremely important that you do not miss any doses of your blood clot preventing medication. If you experience any issues with coverage for your blood thinner, please contact your surgeon as soon as possible and do not delay starting treatment. Some patients may already be taking medications to prevent blood clots for a medical condition. If you are, you will receive specific instructions on how to take them before your surgery. All medications that prevent blood clots can sometimes cause bleeding. Be careful after your surgery to avoid any activities that may cause bruising or bleeding. You may also experience extra bleeding after a cut, from a nosebleed, or even when brushing your teeth. Sudden changes in the color of your urine or bowel movements may indicate bleeding. You should seek medical attention if this occurs. It is important to know that there will be a slight change in your bowel movements if you are taking iron pills. Some natural products and anti-inflammatories affect blood clotting. Please speak with your surgeon or the pre-assessment clinic nurse if you are taking any of these medications. Patients undergoing joint replacement usually do not see dietitians while they are in the hospital, but proper nutrition before and after surgery is important to help with your recovery. Did you know that surgery is a major trauma for your body? Proper nutrition will reduce your risk of post-operative infections. Having a healthy body weight will also decrease stress to your joints caused by extra weight. If your doctor recommended weight loss, please talk to a healthcare professional about a weight loss program. Extreme dieting is not recommended before surgery as it can delay wound healing. Before and after surgery, we want you to focus on a healthy diet with enough calories, protein, and fiber to help with your recovery. If you have other health conditions that require a specialized diet, please speak with your dietitian or healthcare provider before making any changes. Canada's Food Guide provides information on general healthy eating. You can visit their website to learn more. After a surgery, a diet that includes healthy, nutritious foods is important, as you need to eat enough calories and nutrients to keep your recovery on track. In order to eat enough calories, aim to eat 3 meals each day. If you find the meals in the hospital are too small, you can ask for larger portions. If you are still hungry or find you are eating less than you usually do, feel free to have extra snacks. There's a kitchenette on each unit that is stocked with some basic food items and drinks. Protein is an important nutrient after surgery because it is the building block of all tissues in the body. Protein also helps us heal and helps our bodies fight infections. After surgery, we need more protein, and if an infection develops, our needs increase even more. To make sure you get enough, choose a high-protein food at each meal and snack. Fiber, fluid, and iron are also important nutrients after surgery. Please see your surgery booklet for more information. If you're interested in learning more, feel free to speak with a dietitian while you are in the hospital. You can also reach out to dietitians in the community by asking your family doctor for local resources or by contacting a local outpatient dietitian in your region. Remember, after you go home, if you develop a fever, increased drainage from your incision, increased redness or swelling around your incision, severe calf pain or swelling, or unexplained shortness of breath, please call your surgeon or go to your local hospital. If you develop any illnesses unrelated to your orthopedic surgery, you can call your primary healthcare provider.
We hope that you found this video informative. If you have further questions relating to this video or your upcoming surgery, please contact your local orthopedic unit or orthopedic surgeon. On behalf of the Horizon Health Network, we look forward to working with you on your upcoming surgery.